I mean, basically the right hip has some hip dysplasia going on. See how it's not as nice and smooth? It's thickened here. It's not well seated. So he's got hip dysplasia in the right hip. I think looks to me like there's a little bit of arthritis in this left. I don't see signs of tumor or anything, but I mean, it's just not as nice and smooth. There's a little bit of thickening there. And then there we go, for whatever reason. Should be one more. They took the right one to compare, and I think there's probably just, to me, it looks like there's less fluid in that right one compared to the left one. Now, I had Dr. Hallstrom take a look at him too, and when he was under, we really don't get any instability in this knee joint.
Right.
But it is, there's a lot of fluid in that joint itself. So it could be that he just gave it a good twist, and he's got a really good strain in that knee. The worry is there something older? Is there a partial tear of the ligament in there? Because there's an awful lot of effusion in there. And it also could be that he's putting more stress on his left compared to his right because he's trying to take weight off of that. Okay? So we have some options. One is to go ahead and just treat him kind of conservatively, rest, put him on the anti-inflammatory. Does this get better, go away, and return to normal? If it doesn't, and the joint remains swollen, he acts like he's uncomfortable on it, the next step would be to send you to the orthopedic surgeon, have him take a peek at it, and see, does he think there's something more going on in that joint? If you wanted to see the surgeon, I mean, that consult now and not wait, that would be fine too. We usually send you over to Dr. Dassler. He's the surgeon on the peninsula at Bay Area Veterinary Surgery. Good. They're very good at, if they don't think this is a surgical problem, they push the medical. Okay. So I'll kind of leave it up to you which way you want to go. If it's like, gosh, you know, we've had him rested and we've had him on medication and he's just carrying that leg, you might just want to see him. For this,
so you can't see a tear right now.
No, that would actually require some imaging that we can't do.
Okay.
Yeah. For the hip dysplasia, basically, certainly the non-steroidals like the Rimadyl and so forth, we use those. Long term, you might want to consider putting him on a glucosamine supplement. The one that I like particularly is by a company called Nutramax. It's called Dasuquin. I like that one over the others simply because they're all nutraceuticals, so the FDA doesn't test them. As far as I know, Nutramax is the only company that actually tests their product to make sure it's getting in the joint, not just, you know, 9 out of 10 owners thought their animal felt better on it. Okay, but certainly for this, it would be indicated. And then they make a diet called Hills makes a diet called JD, which is joint diet basically. There might be some others out there, some mobility diets through like Royal Canin or something like that. They have some glucosamine in it, but then they also have other antioxidants and things to, you know, help bring down inflammation.
Okay.
So, I mean, those things might very well help this too, but certainly looking long term at that.
Okay.
All right. Now, the only thing, there was a slight elevation of one of his liver enzymes. I mean, it's so slight, it very well could be him. But if we're going to keep him at all long term on the non-steroidal, the Rimadyl, I usually repeat my blood work in 2 weeks. If things are fine, then I go every 6 months with it, provided he has to be on it that long. So what we can do, if you'd like, I think I gave you a week's worth, is go ahead and refill it for, do you want to, or you can call us.
No, I come all the way from Newport News.
All right.
I've had to take off, you know, to come here.
Okay.
I brought him early and was late to work, and then I left work early.
Oh my gosh. So I'm going to refill it. We'll keep him on for 2 weeks, and then probably be a good idea at the end of those 2 weeks to recheck, see how he's doing. If he's not improved, you might want to see Dr. Dassler. He'll probably be closer to you, actually, over in Newport News. You know where the emergency clinic is there? Okay, they're that group of specialists right behind. Yeah.
Okay, well, that's where the dog ophthalmologist is also.
Yeah.
Okay.
Yeah. And if he is doing better, but we're going to continue him longer on the medication and repeat his blood work, see how he's doing. Okay. But let me go get you a little bit more.